we would treat tendinosis versus tendinitis in the shoulder. And so I thought maybe we should first say the difference between the two. So tendinosis is actually the perfect one for Egoscue to treat because it is something that happens when you're out of alignment over a longer period of time. It's versus tendinitis, which can be more acute. It can be when you rip something and you have a lot of inflammation going on. If you just put your arm in a bad position once, that's what tendinitis is. And then tendinosis happens when your shoulder or whatever, it can happen in multiple body parts, gets out of alignment over time. So it's really a chronic condition. And it's the collagen and cartilage kind of being decreased and moved into a bad position. And so Egoscue approaches many things that way because we would look at everything and see what else is out of alignment, because it might not be your shoulder. Your hip might be the starting point and the starting problem. So we might actually treat that condition by working on your hip. So when your hip functions better, your shoulder will go into a better alignment. How about you, Elisa? How would you?
I think you started that off really great, and I agree. It's important for us to kind of zoom out. This is how I like to explain it to clients, especially if they have had any experience with maybe traditional PT or other therapies for this particular issue. Usually you'll find that the approach is going to be very focused on the shoulder tendinosis or tendinitis, either one that you're going in for, honestly. The focus tends to be really just on that body part that's hurting, that has the inflammation, the area that's bothersome. So it's important, and this is what we do, like you said, with Egoscue, to zoom out and really try to get to the root of the problem. And like you said, it's a chronic issue. It happened over time. So if you've been in a misalignment and then loading that misalignment over and over and over again for maybe years, that the point that it starts bothering you is just when your body was just like, okay, this is enough. We can't keep working this way. So I think taking the time to do the full evaluation with your therapist to uncover, like, what are your body's compensation patterns? What are you compensating for? And did that shoulder just sit in a bad place because your upper back actually is pretty dysfunctional and your spine isn't moving the way it should? Or like you said, is it coming from like one hip or the other not moving the way they should? Like, we have to see all the possibilities and narrow it down specific to you and find out what that pattern is. Then we'll know what kind of exercises are going to be good for you. So it's not something where it's like you're going to get the shoulder tendinosis program. We have to figure out in your body, what is the pattern that led to this? Because even if we do get people with the same issue, tendinosis, it's probably going to be different exercises for each person.
Yeah, I love that zoom in and zoom out scope, because just at the end you said we could zoom in and see like shoulder tendinosis pictures just of one shoulder and they all look the same. But when we zoom out, there's 10 different bodies. Mm-hmm. So it really matters what you're bringing in to the appointment with your body as to what sizes you're leaving the appointment with. Lisa?
Yeah, I would say that those are all really great points. And even though we kind of say a lot of the same things, it's all about your position. So whether it's tendinosis, tendinitis, whether it is an old meniscus tear or arthritis or any of these ailments, that especially ones that people have been dealing with for a long, long time, the way that we see it, it's all about your alignment. It's all about your posture, because that tells us a story about your level of function and how you have been functioning, whether that's you went from being an athlete in your younger days to now you just do recreational exercise because you're working full time and you're sitting at a desk. So as your lifestyle changes, your movement patterns do change, but at the core of it, there still is this foundation that you're working with. So even though your symptom might show up as tendinosis in your shoulder, the underlying problem could be in your hip or in the way that you sit or in your commute or in just kind of things day to day, because you're still taking that same body into everything. Your symptom has just shown up as tendinosis in your shoulder, but the underlying problem, like really getting after what is causing that, that takes that zoomed out approach that, Elisa was talking about. Because when you go into other modalities, right, they're going to treat your symptoms, which is obviously a very uncomfortable, painful shoulder due to the tendinosis. So you'll get the right grade, like the typical stuff, maybe some topical creams to help with the pain, ice, ultrasound, e-stem, maybe a hot pack, maybe some massage, maybe some range of motion exercises. Mm-hmm. But if you do all of that, maybe the pain gets better temporarily. In our experience, I can say, and I'm sure you guys as well, we've all had those clients who said, I've been PT for 3 or 4 times and it goes away, but it always comes back. And I don't really know why it comes back. Mm-hmm. And, maybe they start work on their upper back, that gets a little bit better. But, when we take that step back and see, well, you're overusing your shoulder because your opposing hip is locked up. Mm-hmm. Let's try to get that hip to unlock and then start on your upper body. Then you'll see a little bit more of that long-term difference for getting out of pain.
Yeah. And I just want to add to that too, Lisa, like people that say like, oh, it comes back. So obviously there are some people that feel great with physical therapy, which is awesome. Totally. But sometimes it comes back as something different and you might not know it. Like it might not be the shoulder, it might be the other shoulder, or then it might be the other hip. And like, you don't really have the full story, like you were saying. So when you get zoomed in on the part that hurts, if you get relief, great, because obviously that's kind of where you're being hindered, is you're in pain. But like you were saying, get into the root of the problem and then having a sustainable result so that not only is your shoulder better, but you're not then compensating somewhere else and it doesn't start to travel to the rest of your body.
Exactly. And even for this person who is so great to send us this question, I would also say, and obviously the tendinosis is probably getting a lot more of your attention, right? Which is why you asked about it. It's probably very uncomfortable. You might have trouble sleeping, all the things that go along with shoulder problems. Mm-hmm. If you kind of look back over your history, were there any other like same side elbow problems? Did you have neck pain on that side? Did you, have, does your back get tight on that side? Is there any other trends that can tie into that? Because I'm sure you guys can tell as well. You've had that phone call, or you had that person come in. They talk a lot about what's really at the forefront of their mind currently. And I tell us to clients, come in, tell me what's been going on. Tell me everything. So do you want to hear everything? And I say, oh yeah, like we've got plenty of time, fill me in. They'll start off like talking about the shoulder. This has been going on for 2 years. Before that, I was always getting like a lot of tension here. And then I would work with the massage person that would go in and it showed up here. And then, years ago, I was in an accident and the right side of my hip never quite got where it should. And then you start to see this pattern of, okay, so we're talking a lot about that right side.
Yeah.
What's happening on the left side? And so then that sort of steers that conversation to, let's zoom out and actually look at where the problem is actually coming from.
Yeah, totally. Like you're talking about those patterns, but also like old injuries. I had a client that you just reminded me of where, he came in with low back pain, which is pretty common, unfortunately, for people. And it was funny when like you have that light bulb moment with the client and they're like, you know what, I did break my left leg twice when I was little. And what led to that like discovery, like he had never mentioned it before, I don't think. And he was talking about how we were talking about how the left hip doesn't do its job quite as well as it should. And, so we're saying that's probably at the root of everything. And he was like, oh yeah, I did break my left leg 2 times when I was little. I was like, oh, maybe that's where this pattern started. But the pain's in the low back,